Hey, GLP-1 plus size community. Before we jump into the podcast, please take the time to leave us a 5-star review on whatever audio platform you're listening to the podcast on. Share your story and how the podcast has helped you. This will help us get referred up in the audio platform so that we can reach more people that need our help, our support, and guidance from our doctors. Help us get loud and change things.
Are you interested in understanding GLP-1 medications like Ozempic, wegovy, or Mounjaro? Then join us on the PlusSideZ Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The PlusSideZ Podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the PlusSideZ Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together, because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The PlusSideZ Podcast. You're not alone. It's not your fault.
Hey everyone, before we dive in, I really want to share something personal with you. About, I want to say like 8 to 10 months ago, after losing 100 pounds on GLP-1s and keeping it off for a long time, I started regaining out of nowhere, and I was terrified. But I also started having hot flashes and bouts of crying and snacky cravings and waking up at 3 a.m. unable to go back to sleep. It turns out I was in perimenopause, so I started hormone replacement therapy, which is also called HRT, through a telehealth called Winona that specializes in this, and it changed everything. And now I'm sleeping better, and my hot flashes are all but gone, thank God, and I feel like myself again. And it turns out that you can actually start perimenopause as early as 35, and well, I'm 46 and she's here. HRT has really come a long way, and there's just no need to suffer anymore. So if you're like this and you're in the same boat, you can check out buywinona.com and you can use the link in our link tree to save some money.
"20 seconds a week to lose 20% of your weight in a year with diet and exercise. That's the power of GLP-1s through Ro. Ro helps find the medication that's right for you, based on cost, availability, and your weight loss goals. Losing weight with GLP-1s is possible through Ro.
Hi there. Welcome. This is my new co-host. It's Zack.
Hi, everyone.
Hey. I'm just kidding. Kim is not here with this when we're recording it for this podcast. And I decided, hey, I'm going to leave Zack up. He's our community guest today. And I'm going to leave him up because when Kim is gone, I can do all the things. All the things. Like, you're never going to stop me, Kim. Or John, her husband.
She's got all the power right now, folks.
All the power. I have all the power. But anyway, hey, welcome to the PlusSideZ. And if you haven't been here before, welcome. And why haven't you? We are all about health, wellness. We specifically target all of those on a GLP-1 fitness and health journey. And we've kind of evolved into health and wellness. And won a few awards. We're in the top 1% in the world of podcasts. So welcome. We appreciate you coming up and listening to us and are watching us on YouTube. But before I get into anything, I'm going to do a shameless plug and ask you if you could give us a 5-star review on Apple for us, please. I promise it'll be worth your while. But right. But anyway, I know. Yeah. So,
Wait, why are you still here? Why are you still go rate it. Go
yeah.
do all the things, okay?
Hang on. Pause. Go do it.
Yeah.
Okay. All right. Okay. All right. So, uh, anyway, well, welcome to the Plus Sides. We love doing this work. My name is Kat Carter. You can follow me on TikTok, Kat Carter 7, or Mrs. Kat Carter on Instagram. I should probably put them together and make them less confusing, but that's how you can find me. Um, I have been on a GLP-1 journey since late 2022, so it's probably about 3 years. I officially hit the 100-pound mark a few weeks ago, but yay! Um, and it was a long journey. This we're looking at 3 years. So I am what you would categorize as a slow responder. I had the had adventures with hormone replacement therapy that really helped out. I had adventures with perimenopause in the middle of that. But it's been a great journey. So that's my story in a nutshell. I said shale like a good Midwesterner, and I'm hearing Kim in the back of my head saying shale. But anyway, so I just kind of made him my co-host, but he's actually our community guest. And if you've watched and listened to the Plus Sides before, we did a recap of Obesity Week, and Zack was on the panel with us. And so we said, hey, let's bring him back and have him tell us his story, unaltered,
Unaltered.
unedited, unadulterated, the whole story, the whole scandal. We want to hear it all. And this is the point where Kim and I put ourselves on mute, and you can take it away, Zack Niemiec. Right?
Yes.
Got your name right?
Yep. Yeah,
All
you
right.
got it.
All right. Tell us your story.
Picture it, Sicily, 1912. No, I'm just kidding.
Oh, it's my
Um,
heart.
no, but for those of you who didn't catch the Obesity Week recap, I am Zach. I've been on a GLP-1 now for 2 years, a little over 2 years actually. I started December 1st of 2023. And I've lost about 150 pounds overall, about 50% of my total body weight, which has been, very exciting for me. I do also like to point out to folks that I do happen to fall into what I guess would be considered a super responder category. And I find myself very fortunate for that. But the weight loss that I experience is not the typical average weight loss on the medication. I always like to just point that out there because so many people see the before and after photos out there online and go, "Oh, why isn't this like happening for me?" And I'm like, "Well, I did better than the average of the curve, and we all know averages have different points, and then there's the usual middle where the majority of people fall into." So um if in 2 years you haven't lost what I've lost or whatever, remember we are all at different starting points. We all have different bodies, and these medications might not work the same for you as they did for me, but there are many, many, many more coming, so don't give up. That's the other moral of that story I want to say. Now that I've said that, um, this journey has moved far beyond the number on the scale for me, and it's been very exciting and terrifying at the same time. And I say terrifying because I've never gotten this far in my battle against obesity, if you will. I have struggled. I call myself a former bariatric patient. I've had two bariatric procedures and one reflux surgery. At 16 years old, I actually had the lap band, um, which I was successful on for a while until the band slipped and needed to be removed in my early 20s. So it came out. And then when my tool was gone, even though it had slipped, it was still preventing me from a higher volume of food intake. As soon as it came out, the tool was gone. Even if it wasn't a great tool, my weight went back up. Um, so that led to me in 2017 getting the gastric sleeve, or so I thought, and I always just like to say that. But I had the gastric sleeve with a hiatal hernia repair, and unfortunately, the hernia repair portion of it came undone and my stomach went back to its normal size because they only ended up removing about 5 to 10% of my stomach during that procedure, which is not normal in terms of what is normally removed for a gastric sleeve. It is just, it's more normal for people who had the hernia repair that I did, because when they pull the hernia down and wrap it around and tack it into place, you still have that same tubular shaped stomach and food restriction. But unfortunately, like I said, mine came undone. And um, typically on average, about 60% of the stomach is removed with a gastric sleeve. So it's like my tool came undone again. And we all know where this story's going. The weight came back on without my tool in place. I discovered that by getting the reflux procedure done. And that doctor had used to do lap bands back in the day. And he said, if it wasn't for your cool staple line, I would have never known you had bariatric surgery. So, little disheartening to hear. And then how I even got on a GLP-1 in the first place is I had about 3 years of undiagnosable digestive symptoms. I went for 5 colonoscopies and 3 endoscopies over those 3 years. I ended up at the Cleveland Clinic because I had three or four different gastroenterologists trying to figure it out. And first appointment with him, after he was reviewing my results, he said to me, "I don't think I'm your doctor, but that doesn't mean I'm not going to help you." And I was like, it was honestly pretty refreshing to hear that, especially after the years of struggling. And to shorten that story up, he ended up prescribing me a medication, off-label use, that's actually a cholesterol med, but it happens to bind with the bile in your liver. And his theory was something was going on with my liver, and it was dumping too much or too little bile into my digestive tract. Well, wouldn't you know, my liver bile was neutralized because of that medication, and all of a sudden, in under 2 weeks, my symptoms of 3 years pretty much resolved. And that's when I called him up, and he said, "I didn't cure you." He goes, "I've masked your symptoms." Um, And that's when I found out that I needed to get evaluated for non-alcoholic fatty liver disease. And I started a GLP-1 actually uh, a couple of months while I was waiting to actually get in and see the liver specialist, which I had pretty severe. I wasn't at the far end, but I was about in the middle stage already of non-alcoholic fatty liver disease. Um, and what's wild about that is my liver enzymes had been elevated for years and no one thought to pay attention. And so that was one of those medical moments where I was like, well, that bothers me now looking back on it, but that's just, makes you further want to advocate for yourself when you're at your doctor's office and you're reviewing your labs and everything. So um I started on semaglutide, and I was on that for about 59 weeks. I was successful with it, but then I eventually kind of stalled out, and I spoke to my provider, and my provider said, "Listen, you've got a little bit more that you could afford to lose at this point. Um, you're fine where you are, but if you want to, like, this is the max I would say you should kind of go to. I'd be happy to switch you over to tirzepatide at that point, or zepbound Mounjaro for those of you who know it better that way." Um, and I switched, and the weight melted off again, and I got down the rest of the way. And as I was getting close to what I called maintenance, I had kind of an oh crap moment, because I realized the majority of my fitness routine over that, let's call it about a year and a half at that point, was mainly cardio. Now, not necessarily anything wrong with that, but I wasn't doing enough to either maintain or build my muscle. And unfortunately, I didn't get any body composition scans until March of this year. And that was my first one. I got a DEXA scan. So that was my first baseline of my body composition. So I didn't get a picture of what I actually lost or gained from the beginning of that. And that's kind of one of my looking back side, my regrets, if you will. But I realized I need to change this. I need to do it because I kind of looked like a deflated sack of potatoes. Um, and I needed to build muscle. Like muscle is part of health. And I wanted to make sure that if I was going to lose the weight and break free from the scale too, that I was making my whole body healthy. Um, and that also included my mental health as well with it. So like trying to address my health in every single level. And I got very fortunate that my therapist is actually a bariatric patient and he started a GLP-1 because of me, which as a patient to hear one day your therapist coming on saying, "Hey, I want you to know that you inspired me to do this and retake control of my health again," was huge for me, and it was part of my healing process overall. So that's kind of it in a nutshell so far of how I got on the GLP. I'm sure we'll talk more about composition and where the gym has led to, but um it's been a wild 2 years.
That sounds amazing. What a story. I would say because I would chime in and say, well, Kim has had lap band, and she said it really didn't do. It did something for her, and I think that lap bands are still. I think they still do them
They do.
here and there. Yeah, they're just not as well. Per Dr. Rosen, I'm not a doctor, but Dr. Rosen said they're not that effective anymore because they're not. It just restricts. It doesn't. Um, what is it? Doesn't bypass. There's something in the gut. You know what? I'm gonna leave that to the experts, but there's something in the gut when you get a gastric bypass that
Yeah,
encourages
so
more GLP in your system, whereas the lap band did not do that.
yeah, so when you
Mm.
get a gastric bypass, I like to call it, and this is a simplification, but a gastric
Right.
bypass not only reduces the size of the stomach, it reroutes your plumbing, so to speak, your intestines, and of where the food comes back in and your absorption
Mhm.
is. So it's considered a malabsorptive procedure,
Mm,
um,
okay.
and that's why those patients are at more risk for nutritional deficiencies than say a GLP-1 user or a gastric sleeve or lap band patient
Well,
are. There's always still that risk, but yeah,
mhm.
no, you're very right that those are different and they
Yeah,
do work differently.
that's quite a journey. I'm glad you're here. I'm glad you're here with us, and I just realized while you were speaking, I know that we talked at Obesity Week and we recapped it, but I actually originally got to meet you in person at the Obesity Action Coalition in DC. So
Yes.
we did a lot of Zach this year.
Yeah, no, a lot of Zack. Yeah, hey, it's coming up, Zack, and then, um, I got to see you guys in Atlanta twice this year too
Oh
because
yeah,
we did that
parallel.
other
Hmm.
thing. So, yeah, no, we've got to
Lots of
run
Zach
into
this
each other
year.
a few times this year.
Yeah, it's all fun. We really do enjoy that. All right, so I'm excited. I did not get to meet our expert that we're bringing on at Obesity Week, so we just decided to bring her on to talk to us because that's what we wanted. Since we missed her presence when we were at Obesity Week, but we were only able to be there one day. So I hope you listen with all the bated breath. Plus sides community. I think she's going to be a great guest tonight. So, or this afternoon or this morning, whenever you're listening. So, I'm going to bring to the stage Dr. Nina Crowley. And drum roll, please. Hey,
Hey,
hey, so good to
how
meet
did you
you
know? I had
virtually.
so many things to say while Zach was talking, and I was,
Take
you know,
notes, right? Yeah. We have much to go over, so I'm really appreciate you coming on with us today. um just really quickly, I'd say like run down your resume, but let's chat about like your background and how you help us in the community.
sure. Well, thank you so much for having me. I'm really excited for this
Yeah.
conversation and the ability to have a little bit of a longer format to talk because I love to talk about this. And
Good.
Everything that's on
We love
the
to talk.
menu for us. So I'm Nina Crowley. I'm a registered dietitian first. That's what I started doing. I landed in a bariatric surgery program in Charleston, South Carolina. I'm originally from Long Island, and I absolutely loved it. It was totally my calling, my people. I was an inpatient dietitian for a minute or two and realized that was not my thing. I was really into talking to patients and learning about their history and their stories, and that just doesn't work when you have 20 patients in a hospital to see. So I knew I'd land in some sort of a counseling role. I found the bariatric community kind of by accident, loved it, but realized after, a couple months of being a dietitian for that program that I didn't have enough psychology on board to just be a good dietitian. And so I always say I went the expensive and maybe low ROI route of getting a PhD in health psychology to be a better dietitian. But I do think it did that. I feel like it really taught me so much about, the lived experience of obesity, the psychology side of it, the behavioral part. And so I did that for about 10 years. And then during that time was, getting my PhD, and then decided I just loved our program and had so much that I wanted to fix. I'm a major fixer. So I tried to put all my energy into doing that as the director for the metabolic and bariatric program at MUSC in Charleston for 6 more years. And then maybe have a little burnout, I think is what we would call it. Honestly, with the insurance and the protocols to get bariatric surgery approved, it was really tough. And I, just when I thought I had the perfect system, insurance would change. And so I know that's what we're all experiencing now in the world with medications, but in surgery, which was sort of available first, it was hard. And so I actually came to work for SECA, which is a company that makes the bioimpedance equipment that we'll talk all about today. They're a company that's been around 185 years. They have this almost like a museum of their old devices. Like they were around when scales were first made to sort of just weigh things in general. So they've been through all of it, and they've evolved with all of it. And so now, for the past several years, have been doing body composition through the bioimpedance technology. And so I work in the Charleston office with healthcare providers and clinicians to educate them on how to talk about bioimpedance and body composition, how to work with patients once you get a scan done, and how to help them sort of connect the dots and make behavior change based on their results. So for me, it's getting to put my nutrition hat on, my behavior hat on. I love working with this community. And so it's been a really fun time. I've been in that role for almost 4 years. So very happy to be working, with patients. I am on the board of the Obesity Action Coalition. So that's been for the past 6 years. That's been my passion to be able to work in the patient community. And so new for me was sort of hanging out with Zack and Mike and learning a lot more about beyond the patient community that I was aware of, sort of the TikTok community. And so I let them convince me to join TikTok, and haven't been as active there because I'm
Zack.
LinkedIn and Instagram, but it's another one. So I love it. It's been really nice and just sort of new. You've been in any field for a long time. It's like there's so much new coming out every day. It's actually really almost overwhelming. So but so I'm glad to land here and talk with you guys and share what I know and love about body composition and how I think it can align with the patient-centered care and finally the whole push away from just looking at weight. So it's the outcome that we focus on.
That's really cool. So were you at the OAC conference in DC in July, and I missed you twice this year?
Yes, you missed me. My colleague Danielle was doing the measurements at our booth, and I was hiding in the back listening to my friends give talks. And so I get to have a fun role at conferences. I get to go sort of listen to the education like the healthcare provider, and then let someone else do the work at the booth and just kind of, socialize and hang out with my people.
Wow. I had to go all over and finally get to see you here virtually. I could have just
I like to travel a lot with this we're also
Yep.
we'll be at something in 2026 for
Yeah.
sure. We'll make up for lost
Yeah.
time for sure.
Yeah, exactly. Exactly. You know what? When you mentioned like the old equipment to take weight, I'm currently reading this book, Fearing the Black Body by Sabrina Strings, The Racial Origins of Fat Phobia. And I found out that the first, I guess, measured healthy weight or weight to gauge weight by health was developed by Metropolitan Health MetLife now. So
Yeah.
I thought to myself, dang it, it would be an insurance company.
Insurance, yeah, the whole history of how BMI was developed and how it was used initially for risk and excluding people. Of course, that feels familiar.
Yeah.
Very interesting. I do have I can share with you too. I did a series on the psychology of weighing and sort of looking into the history of that. So if you're interested in sort of a deep
Yes.
dive into that, I can share that with you as well.
Yeah. Oh yeah. This is going to be a juicy episode. Okay.
Also, I'm gonna shout Nina out as well, because Nina has a bunch of stuff and papers about patient-centric language to reduce stigma. And without that kind of work being in the space, we
Mhm.
would not have changes that actually happen, even if they're the small little changes, like your doctor's office having the wider size chair for the plus size person, or your doctor actually asking permission of you if it's okay for them to ask about your weight. Like, having those kind of resources out there and having clinicians read them and absorb them and realize that they could do better with the language and how they
Mhm.
approach it to make it feel like a safe conversation, that is incredible. And Nina's paper on it is really great. So
Oh, I want to read that too. Oh, okay. We're gonna have to figure out how to get all this in. So I'm gonna ask you the first question that we have like kind of lined up to get everything started, since it's kind of centered on body composition. But I'm gonna get into that patient centered conversation. That's something I think that our listeners will really enjoy. Can you describe how DEXA and body composition scans work versus the typical like weight and measurements like the old fashioned way? What's the difference between DEXA and via body composition scans and the old fashioned? Do we do all three?
Yeah, we can tackle all of that. So yeah, so the way I always try to frame it, if you were to get, one of our scans, which is bioimpedance is the technology, which I'll tell you all about, is I usually try to show someone really on there your weight or BMI first and say, like, before today, this is really the only number that you've had to work with or to understand, right? It's the, the gravitational pull of your weight to the earth. And so that measures just that. And so that's the number that we've all, anyone in our sort of age demographic that we've grown up with. Zack's way younger than me, so I don't know. But it we've grown up with this number, and that's the number that we know. And so I usually just really try to start the conversation about that, and that it provides some data, right? So there's the past couple of years, there's been a lot of like, there's this camp or that camp. We still have weight, we still have BMI, of course. I don't know that we're going away from those numbers completely. And so we do want to sort of put it in its place and figure out where that still has relevance. And honestly, a lot of times we make our decisions based on what insurance covers and what they use. And so they are still using those numbers to some extent, though the indications for some of the medications have removed some of that restrictive BMI language in favor of saying, someone with the disease of obesity, giving a little bit more flexibility to say they might have it based on these other maybe health conditions or body fat percentage per se. So I'd like to frame it sort of talking about that. That's the number that you have and that you know. The good news is that finally with body composition, which is really that big umbrella term for all of the methods that we have to assess what's inside, right? What besides just the weight is in your body, from, muscle mass, which is I think what we seem to focus on the most these days, to, your adipose, your body fat, the water, the minerals, and then there's all, there's little other things. And so all of those things sort of add up to weight. The first way that I like to describe it is when you're breaking that apart, usually we break it into two compartments, the fat mass and then the fat-free mass. So those two numbers add up to what your total weight is. The weight of all the molecules in your body that are fat and the weight of everything else. And there's a few different ways to measure those two numbers. So
Mhm.
most people, when you talk about body composition, they'll give you, well, this is what my body fat percentage was. So when you first ask, what does DEXA give you? They can give you what is your body fat, and then the everything else, that fat-free mass. In a DEXA scan, it's looking at an X-ray, and it can tell the difference between sort of your bone tissue, your lean mass, and your fat mass. So
Okay.
DEXA is going to give you those three things: how much bone density, and it's small. It's I don't know the range, but it's under probably 10 pounds of your skeleton, your bone density. And then the lean mass. Lean mass, you'll hear me talk a lot about language, not just patient-centered language, but when we're talking about body composition, because there's so many terms floating around there, and probably the one that's most misunderstood is lean body mass or lean mass. And what that really is lean soft tissue that you can look at from a DEXA. That plus bone density plus fat equals your weight. So when you look at a DEXA, you're getting a big number. It's a high number for your lean soft tissue. But what we're probably really wanting to get down to is more, what's the muscle? Because lean soft tissue includes water. It includes your connective tissue, your skin, which, when you've lost weight, that's sort of something that's hard to figure out, like, where is that sort of landing in the body's components?
Yeah.
So the best way to look at your true sort of muscle mass that we have right now is looking at a whole body MRI, and that can tell us what your skeletal muscle is. That's not something that we're going to do sort of in a clinic in person very often. And so often you'll hear us in the body comp world talk about reference method. So the reference method is like the best we can do at the time to get the best estimate of that body compartment. And then we have other methods that are validated to that reference method. And that's where you'll hear people say, 97%, 98% in accordance with those reference methods. So DEXA is one of those reference methods for the body fat compartment, but it doesn't tell you anything about the muscle mass. It just gives you about lean soft tissue. So for me, one of the things that I love about the company that I work for is we make body composition equipment that's called bioimpedance. I've said that a couple of times. I'll tell you what that is.
Bioimpedance, is that what it is?
Bioimpedance, bioelectric impedance, BIA is the acronym.
Oh, I thought it was like biopedia, bio.
Bioelectric impedance. My computer doesn't ever know how to spell it correctly, so I'm always having to correct it. So what that is, it's very, it's interesting. It's an electrical current that's sent through your electrodes on your feet, through the scale-looking creature that you're standing on, through your feet and out through your hands. So if you ever get one of these done, you have to take off your shoes and socks, and you're hopefully gripping a handrail where the electrodes are there in your hands and in your feet. They're sending that electrical current through the body's tissues because it goes at different speeds. So it goes fast through anything with water. The electrical current goes faster, and muscle has a lot of water. So it goes faster through sort of more muscular tissue and slower through body fat. The resistance of the fat to that electrical current slows it down. So you've got this like resistance and reactance, which we don't actually talk too much about that to a patient, but that's the technology. Those two numbers get put into these formulas that are validated with those reference methods, so that we can say with pretty good confidence, 97 or 98% in accordance with a reference method, we're able to estimate that body's compartment's composition.
Okay.
So that's a lot. That's a lot of words. I do feel like people are always wanting sort of the one line or the easy explanation, but it is a little bit more complex and nuanced than that. But it's important because there's also a lot more body composition assessment tools out there than there used to be. There's also a lot of clinicians I've found in the field who, I've been out of school like 20 years. Some even, older than me, longer out of school. Back then, there weren't that many methods. So what we learned in school was like underwater weighing.
Yes, I remember that.
Or even some people still, would know about the air displacement or something called a bod pod. That one's a little tricky because
What's the bod pod?
The body
Right.
looks like a little spaceship. If you've never seen one, it's an inch. Like if you Google it, it's sort of funny. I like to use their pictures in my presentations because nobody wants to go in one. You have to put on like a swim cap, and it's basically measuring the air in this little capsule that your body's not making up the
Wow.
the space in. So it uses some, formulas and algorithms as well, prediction formulas. But
Mhm.
that's measuring sort of the air displacement. I don't think many people use that in a clinical setting because you have to strip down to like a bathing suit, put on a swim cap, and you're still not really getting muscle mass. So
Wow.
really right now, the best sort of consumer, friendly, something that you would get in a clinical space at an outpatient, doctor's office, dietitian's office, even at a gym, is bioimpedance. And then within that category, SECA, where I work, is
Yeah.
one company who makes their devices. There's several others that do that, and then there's this whole other category of like home devices that we can talk about a little bit later too. That people get at a much lower price and obviously at a much lower sort of
Yeah.
accuracy to some extent. But that technology is what we have now, and so that's how we can estimate those bodies compartments, and then
Mhm.
we're able to see sort of change over time, or as Zach talks about, wishing that he had a baseline assessment. I think that's an important
Yeah.
component that I really got sort of the details on when he and Mike and I talked at Obesity Week, because some of the DEXA devices that people were going to, so you're laying down flat in a machine that's, like doing an X-ray, takes a little bit longer.
Yeah.
But they have weight limits, and most of them are 350 pounds or less. And I didn't know. Mike said he had to strap his arms in, and they were like binding his arms, and so that was I didn't know that. But yeah, I mean, my background, of course, in bariatric surgery, like we had a significant number of patients over that weight limit. So if we didn't
Oh,
have a starting point, much like Zach describes as a regret, like not knowing where you came from at your ultimate, sometimes you never know
true. Yeah.
what your highest is going to be, to know that that's the point where you want to take a picture or a assessment, because probably every time you're doing something new, this is the time that's going to work. Right. And so I have a lot of, stories of patients who didn't have that data and would have liked it. So our bioimpedance, our scale, I can't really talk to all of the others, though I
Yeah.
know a good bit about them. Ours goes up to 800 pounds as a weight limit. It's a much bigger scale, so it's not like a tiny little one that's tippy, and you have to spread your legs apart so that the
Mhm.
um, current can go through your legs, not touching. So that's a component of it too. So yeah, so there's a
Yeah.
lot of factors involved. I mean, what's exciting again for me at this time is there's so much new technology and things being developed and getting
Yeah.
better and being researched, so much more interest in it, that I think we'll see a lot more advanced, technology and imaging, um, as the next couple of years unfold.
Yeah. People talk about DEXA quite a bit. I hear it a lot on TikTok. Wasn't familiar with SECA until OAC. But I was too scared to go in there and get my weight taken. See, yeah, we got to talk about the psychology of the scale of the
There's a
brain.
lot. And I have a slide that I give a lot in presentations of like, part of the deal is explaining to patients that this that looks like a scale and is a scale, and this that looks like a bioimpedance device, they look similar. And so, there's part of that education that the provider
Yeah.
and clinician needs to do, is telling people this is what's different about it. This is what information we're going to get from it. And this is how we're going to use it. We don't want to just, it would make me very sad if people were just getting the device, getting the printout, throwing the paper at the patient, and not having that really rich conversation about
Yeah.
what the data means and how to use it to, kind of enhance your goal setting and monitoring, and focus away from just a pure let me lose weight. Because we can talk about
Yeah.
long-term goal setting and numbers and all of that, but behaviorally, a goal weight is problematic a little bit.
I can agree with that. I can definitely agree with that. But yeah, I definitely I was not afraid at Obesity Week, and I stepped on that scale. I didn't care, and I was very surprised. I got a baseline goal, so But yeah, I can see there's so much anxiety with goal weight and base and even stepping on the scale.
Did you find one of the things that I always, kind of think when you have just a singular number, it's easy to sort of wrap all the behavioral stuff into I'm doing this and this and this and 12 different things in my diet and exercise and lifestyle. And then you're still just measuring one number. Whereas when you're looking at sort of a more complex picture um,
Yeah.
of some of the body composition parameters, you're looking at muscle and fat and maybe visceral adipose tissue around your midsection, even looking at water and some of the other stuff there when you have more actual numbers, if we are saying numbers are part of that picture, you're able to sort of spread maybe not the anxiety, but spread the energy around to let me look at these different components. And it's less like it's just one thing.
Yeah, like I'm excited to like look at it again or get weighed again and see like how much maybe muscle I was able to put on. Just yeah, really, that was my focus when I got my results. I was
Mm.
like, oh, I need to put more muscle on. I'm like a pound away from like being a superstar. Okay, that's my category of being a superstar. I guess in my mind, I was like, I am a pound away. I'm a pound away. So
It's
I
good
Well,
to have other goals like that too, because, we talk a lot about using body composition in the obesity care space, but there's, there's a big application for it in athletes and in
yeah,
fitness. And so, their weight range might not change very much at all. And they're still able to really use those data and parameters to focus on change in those other compartments. It might not be as large volume change, but seeing small changes is especially helpful when you're talking about maintenance, where kind of that goal is keeping the total weight number
yeah,
static or stable.
Quick pause here. I've had moments on my GLP-1 journey where insurance changes or rising costs forced me to look for a new provider. And honestly, that process can feel very overwhelming. But that's why the Plus Size podcast has partnered with GLP Winner to give our subscribers a resource to help them make that decision easier. GLP Winner is a comparison platform that lets you explore telehealth providers in all 50 states, whether you're looking for brand name medications or compounded options. You can see pricing up front, read reviews, and get a clear picture of which provider might align best with your needs. Check it out today at glpwinner.com slash plus sides. That's glpwinner.com slash plus sides. Don't forget the Z. Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m., and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again, and the hot flashes are gone, which is, geez, really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through this same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our link tree, you can click on that and save money. If you go there and you meet all the criteria, and this might be something for you to try. So I just want to make sure you had this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our link tree and get what you need.
Want the fastest working GLP-1? For half the price, Ro now offers FDA-approved weight loss injections cheaper. With results you can see faster. Lose 15% of your weight with the formula from Eli Lilly that hits not one, but 2 hormones to curb hunger and nausea. Weight loss faster, confidence higher, price cheaper. See if you qualify at ro.co/TV.
real quick,
yeah,
I just wanted to jump into like on there. You mentioned like the behavior part of it, and like I had to break up with weighing every day, and now I'm like once every 3 to 4 weeks.
agreed.
Which was huge, but like during my whole journey, I was every day, and like it was like that little dopamine hit for me
Mm.
for my reward center, or what part of my reward center wasn't being affected by the tirzepatide. Um, but like that was what I was so glued to.
Mhm.
Um,
Right.
and when the weight became not the focus anymore, I was like, well, what am I doing? Because this is either causing me angst or not excitement anymore, either necessarily, because it was just, I was trying to literally stay within the same range. Like,
Yeah.
which is, like I do when I get on now and I'm in that range, I'm still excited. But like it's like, all right, now I got to put this away again for a few more weeks. That's crossed off the list and I'm going to work on all these other things. So like learning and then unlearning the behavior is is definitely part of this journey too.
It's
It's quite a process.
I think in that frame too, I started thinking about it. If you make a comparison to something outside of weight and health and behavioral change in that area, almost, I thought about it like financially, right? If you were talking about financial goal setting and sort of you made a plan to save this amount of money or to pay off this bill or whatever, but then your long-term goal was to just like have this stable amount of money, like that's not that exciting long term, right? So sometimes, thinking about staying at a certain weight, part of the reason that's a tough goal is just it's we need something future out to like motivate you. So like staying the same of anything is sort of a tough goal. And so that's why I think again, athletes can work on their body composition, athletes can work
Yeah.
on their fitness and their functioning and their strength forever. And they're always working towards that. And that can always be a goal that's much more directly tied to what you're doing. It's hard to figure out like what you're doing day to day and how that impacts that number on the scale that's the outcome only. Even though right now, like and Zach, we talked about this a little bit, even though like in the journey, it feels like the effort you're putting in finally is being matched by this number moving, but like you never really have control over the weight when it wasn't moving or now. Like that's gonna happen. So
True.
even when you were talking earlier about like the weight melting off, I don't love that term melting off for a few reasons, but I also think it's tough because that's happening probably regardless of how tight you're sticking to whatever behavioral control things we have. Um, but it also doesn't help you get that feedback when it's your efforts, like you doing the work to stick to the eating plan, the
Yeah.
exercise regimen, all of that. That's the thing we want to affirm and stick to regardless of what the weight's doing. And you need feedback on that so that you keep being motivated to do those healthy behavioral things even when the outcome isn't where you
Yeah.
want it to be.
That makes me think of when you say like the weight could be problematic or like a goal weight. I mean, there could be days when you could just take that popular tea that, your friends and you used to take, or I used to take like many years ago, and just be stuck in the restroom for a few days. And then, yeah, it would push down 4 pounds, like, oh, but all you
Yeah.
did was just lose water.
Water
Um,
shifts, I mean, that happens. And even in, that's another piece of this too when we're talking about body composition is that if your weight is fluctuating like this,
mhm.
your body composition numbers will as well because they're still trying to tally themselves up to 100 or to your total weight. And so too frequent assessment of your body composition can make you as probably crazy as it feels to be trailing and tracing and chasing the weight number
Yeah.
because they're not connected. It's not like you gain 2 pounds of muscle overnight. So I do like there being space, at least a month, maybe 6, 8 weeks even between body composition assessments so that you can see the true impact of the changes you're making, that they're true changes in body composition and not just water or fluid shifts.
Right. Could you touch on also I s- I harping on it, but the psychological or the effects of what are all the things that make having a goal weight kind of problematic besides the incessant obsession? What are some of the other issues?
Yeah, I mean, so the one being just it's a tough connection to your goal setting. That one we've sort of talked
Yeah.
about. I think if we were to really dive into all the complex ways weight as a number has dictated our lives as people living in this time, people who've struggled with their weight from a young age, like that number has sort of
Mm,
carried a lot. And I would hear it the most when I started as a dietitian talking to patients about, um, you know, some of the things that I would talk to patients about up front is, do you have a number that, that we would call a goal weight? I probably used to talk about that more than I would now if I was doing it. And there's a lot that's packed into that number. This is my wedding weight, my high school weight, my, fill in the blank of something. What I would always hear when I heard those type of, numbers is whatever they're connected to, right? So if you're saying wedding weight, like what about that was it? Why are we connecting it to that? Why was it in high school? Like what happened? So to me, those are all little clues that would sort of
mhm.
lead me down, to pull on that thread to sort of figure out what are we actually talking about here? Is it a happier time, right? And um, there's a lot wrapped into what that number means and what it would mean to get there. So I,
Yeah.
I would always, dive a little deeper into those type of questions. That would be one other, kind of psychological impact.
Mhm. Okay. Speaking of, I'm going to skip over. I'm going to just go all over the place. So speaking of that, we saw the World Health Organization release new guidance that explicitly recognized obesity as a chronic and complex disease. So, in your opinion, how does this affect the future of obesity treatment? Will this help us move the needle even further in the medical community, recognizing that obesity deserves access to medical treatment and also behavioral therapy?
Yeah, when I saw that, what really struck me too is for almost 20 years I've been in this space. We had to go by the 1991 NIH guidelines for bariatric surgery for
Wow.
for like my whole career, right? Until they finally a couple years ago sort of updated those recommendations. And so to me, this is like we had the Lancet report come out with some guidance around, diagnosis of obesity last year. The American Medical Association came out with, hey, BMI is problematic. Let's use some body composition instead. To me, it's
Love that. Yes, it's
they're
problematic.
they're, they're waking
You heard
up,
it here. Right.
and so waking up to see that the way that we did it wasn't working. Now we have treatment options that make it hard to argue, and they're going back and looking at, well, these guidelines may have been problematic. So I love to see that they hit some big language markers for me in talking about it as a chronic disease, using patient first language, and really recognizing the support that may be needed in varying amounts for different people, from nutrition and behavior and exercise and, all of that in medical support. I think that's really exciting.
Mhm.
I think it's pretty validating for people who've struggled to see the bigger organizations coming out with recommendations like that, because again, the hope is that it trickles down to insurance maybe, and they start to see they do go by, the clinical practice guidelines and the big recommendations. So the more of them that are sort of in the same boat, on the same, kind of moving in the same direction, hopefully we can see some change. And even though sometimes it feels slow and there's so much that needs to happen from access and
Yeah.
advocacy and price, like I've never seen anything actually move this fast in the time that I've been in this space. Like I'm almost like I need a break from how much news is coming out to be able to process each one of these things, right? Like Zach, I put out our podcast the day that these guidelines came out. I'm like, damn, that's an important thing to talk about. But I've been working on this podcast. I want to publish it.
Well, here we are. No.
Breaking news. This just in. Something else. And another
Yeah.
thing. And another thing.
Always. Every day. Every day. Um, so actually, okay. I'm gonna ask it. So I had a conversation with some friends this weekend about continuing to stay on the therapies. Do you stay on it, or the popular buzz phrase, the buzz term, or do we phase off? I'm of the camp, well, I feel as if my thyroid medication, I have to take that every day. I'm not going to just stop taking it because my thyroid is back to normal. Because I stop taking it,
Right.
it'll. But what do we say to that when people say this is like just a fix, so to speak, right?
This ties in a few different things you've said, which, just the last about the World Health Organization and chronic disease, like understanding obesity as a chronic disease is not just a buzzword that, like, if we want people to say. What that really means is chronic means a lifelong relapsing condition that may need varying amounts of treatment over time, right? And so if people actually understand, that's your benchmark. If someone understands what that means, if they understand what that means, that the biology is the component that is not functioning properly, then it is most likely that you'll need a biological agent to change your chemistry and stay at that weight reduced state, or
Yeah.
however we phrase it, right?
Uh-huh.
If if we're telling people use the medication to take off a significant amount of weight, but then fall back on diet and exercise, like, to me, that's missing the point completely, because that's back to shaming you that you didn't know what to do then. We helped you get this off, and now it's your responsibility to keep it off with good nutrition and exercise, because that's what the right way to do it is. I think that's, in a big picture way, what's really problematic with that.
Mhm.
But I would take it from the angle of, like, every patient in front of me is a different person and has different impact of biology, environment, all the things, right? When you look at these graphs of what are the components, there's lots of things impacting the person. So I would say, as the individual, take that as, well, try it. Try and experiment with yourself, right? The difference with medications than the surgery world that I grew up in is that the surgery, and it's still not even looked at these days, finally, is not one and done, right? Zach knows this, but it was for a long time. Like, you get this one chance, don't mess it up. But
Oh yeah, that
with
was another part
surgery,
of the conversation too. I just it was like, what's the point of getting it? You're going to gain it all back, even if you get a surgery. And it's just like,
yeah, the difference that I'm hearing people understand a little bit more with medication is that, you're going to tweak it over time. You may change them over time. There's a reason to stay on it, because maybe it's working for a while, and then maybe it's not, and there's other options that come about, or target a different component. I mean, the real goal is that we have what they call, like, obesity phenotypes, or, different types of, people that we could somehow assess and say, hey, you're the type that, like, we know this from people's language. People will say, like, I'm the type that I get really hungry and the craving. That's a component. There's others that maybe their resting metabolic rate is really low, and that's something that is, part of
mhm,
their story. The goal eventually, I think, would be that we can figure out what someone's sort of type is a little bit more, and say, okay, well, let's try this. I mean, and there's other meds other than GLP-1, that
right.
class of medications that still can be really good for folks, or combined. We're finally moving away from, like, just one med, just one surgery. It's like, let's take the person, experiment with what we have available, and see how they respond, and go from there. And then, hey, maybe then like, I don't want to minimize nutrition and exercise as part of the conversation.
Yeah,
It's,
we need that muscle, right? We need the protein. We need to.
we do, but it's not the only part of the story. And when you
True.
tell people that they can maintain their weight with your special program and your special diet and supplements and exercise regimen, like, for me, that's a big red flag. And I would have to, really dive into that. But I think we kind of need to go into it with an assumption that you'll always need treatment to some extent, and varying degrees of what that treatment is are going to differ by the person, and that's where you have to have a good team of people that are willing to go on that journey with you and help you figure that out.
Yeah. So it's a holistic process. Like we really have all been kind of saying and learning
Yeah.
throughout these last couple of years. And it's
But
not
it
just
makes it hard. It
right.
makes it hard when, I mean, the other sort of side of this is what I'm talking about, and what we're talking about here is like comprehensive health care. And we're also living in a time where the commercial entrepreneurial nature of things is bleeding into healthcare. And so it's much harder to take an individual on a lifelong journey when your
Right.
goal is to just get them on your thing as cheap as possible, and hopefully they're fine and they don't need any extra help, right?
Hmm.
So I guess I would just say, for the individual person listening, know that nowadays you have to probably be your best advocate, and
Yes.
finding your team of people around you to help with the different parts. And Zach, I think you did probably one of the best explanations of that when we spoke about how you're tackling different components and working on this or that part of yourself to optimize. You don't have to do all those things and you'd still have a great result, right? Um, but your goals are more than what was expected, and you're free to pursue those and have a team of people to help you with that. And I think that's really great.
Yeah, just the other day, my care team got expanded by another 4 physicians, because
You're popular.
I'm experiencing a very unique nutritional deficiency, um,
Interesting.
and no one is really entirely sure how to approach it right now. Um, but I have a copper deficiency, and my copper number keeps going lower, even though I'm taking 8 milligrams of copper a day. So I just got another GI doctor, an obesity medicine specialist, uh, and a few others, to name on the list. But my liver doctor is the one who is looping all of these people in,
Mm.
because he's like, "All right, we're gonna solve this as a team." So I've got like a Scooby Doo crew being built and led by my liver doctor, and I thanked him on the phone for that, actually, because he was like, "I'm not supposed to be the one leading the charge here." But
Hmm.
he's like, "I'm gonna help you get this figured out." So it was really kind of nice. But like, on that same note though, of being your own advocate, I got into this position because I started to point out, hey, my copper level is continuing to go lower, and you're telling me to just take more and more, and we're not seeing that number come back up. And that's just one instance. But don't be afraid to change people out in your care team if you feel they're not listening to you, or you feel like your care team is incomplete. Find someone to fill whatever's missing in your care team.
I
You got to
agree with
feel
that.
comfortable with the people caring for you. Is a little take home message I like to drop too.
Yeah, you definitely want to make sure that you feel comfortable. I have a pretty good team as well, and then I'm in a lucky position where I can talk to really caring practitioners every week, every day. So it's great because I feel like 'cause I always I guess a little bit Pollyanna like, but before we started doing this work, I know that a lot of us in this community got kind of we were burned, or maybe we're just kind of averse, doctor averse, medical
Mhm.
averse, because we had been talked at so much. But this work has really showed me that there are people out there that don't talk at you,
Mhm.
that genuinely do care, and that are experts, and they're not just blowing fluff and telling you to go to Weight Watchers, for example, or things of that nature, or pulling out the remember the old school fat measure, that little pincher that
Oh,
Oh gosh. Yeah.
pull that
Yeah.
out, measure your fat on
And
that.
it's funny too, because I've been being sort of part of that Obesity Action Coalition group for the past, knowing about them for years, and then being sort of on that board for the past 6. Those are my people that do all of that work. And so it's been actually really fun this year to sort of share that with a greater community and sort of help other people see that, like some of the folks that you may have interviewed too, some of the psychologists and exercise specialists and the obesity medicine physicians, like there's more like that. And we're doing the work to teach the others how to do
Mhm.
that, right? So some days it does feel overwhelming that the general public is not getting getting it, or getting the care that they needed, or getting the practitioners that they need. But I am, you know, constantly affirmed that we are in the right place doing the right work, and hopefully that'll spread.
Yeah, I think so. I did want to ask this question as well. Lean back on like SECA and body composition.
Yeah.
Um, can things be caught early in these body comp measurements, or like say bone density issues or things of that nature? Can things be detected, for example?
Things like health conditions or health
Yes, yes,
problems.
health conditions. Yes.
Um, so the bioimpedance technology doesn't know what muscle,
Okay.
I mean, doesn't know what bone density is. So that'll
Okay.
be that'll be part of the fat-free mass, but not part of the muscle mass. So it'll kind of be in between those two numbers. So we wouldn't use that technology to do the bone piece of it. Regular DEXA scans, of course, looking at your bone density changes over time, if you're on the same machine repeatedly, can help, look at problems in that area for sure. I mean, they've been doing that long before the DEXA added on the body comp stuff, you know.
Mhm.
Um, but from a, I wouldn't say it's diagnostic for health problems, but it's sort of like you
Okay.
can piece together a picture, right? So you can look at what's happening with someone's, so take muscle mass, for example, right? If you looked at someone's um, pre-treatment muscle mass, and then you're able to trend, and we have some new cool graphics that I spent some time playing around and showing Zack, but you can see, trend over time with your muscle mass. If you're seeing that coming down and faster than the fat mass is coming down, that's an indication
Yeah.
of course, something's, not working well. I also think it's responsible medicine for people, for doctors and teams to be measuring body comp, because if we looked at Zach right now and just got a body comp today, I mean, even you getting it in March, right after you've already lost a significant amount of weight and changed your body comp around, we don't know. Is that you always? Is that the medication? Is that surgery? Is that something else? So, I
True.
feel like it can also help us pinpoint at what point are we seeing a change. And again, the longer things are happening so quickly, I'm sure we'll start to see some research studies coming out soon
Yeah.
that are actually saying at what level do we need to make change, right? We have to be sensitive that people don't want you to take their medication away, right? So sometimes, like, if you see a change too much, like, it has to be sort of a trusting and honest relationship, right? And that's a part of the conversation, is sometimes people don't want to report certain symptoms because they're like, I still would rather tolerate those symptoms than to, have this taken away. But I would say regular testing, which would probably be every 3 months, every 6 months,
Okay.
could help you see changes to muscle mass that could indicate that's too fast, or that that's not changing, and that you maybe had a lot to begin with, and that's a different phenotype of a patient. Someone who started out with a lot, they have a little more to lose, right? So
Mhm.
there's also this sort of fear around medication causing significant muscle loss and wasting that, I'm sure you guys end up talking
Yep.
about a lot in
Yeah.
this community, and what is too much. And we know that some loss is sort of normal with every type of significant weight loss, not specific to the medication. And what I've generally seen is when you're looking at that fat-free mass, which would be, you could see that number on DEXA or bioimpedance, regardless of the brand, is if you're losing more than 25% of your weight as fat-free mass, that would probably start to be in the maybe too much category. And that would
Mhm.
probably indicate let's look at that. Maybe that's when you start to add in more focus on nutrition and exercise for someone than someone else who's
Yeah.
not in that experience.
That's fantastic. Well, this has been like a really, really great conversation. I want to ask you one more thing. It's kind of like encompasses everything in a nutshell.
Mm.
When it comes to you, like say approaching, say nutrition, working with bariatric patients, things of that nature, what is like your motto that you go into practice with before you like sit down with, or you sat down with the patient? What is the motto that you have?
Oh, that's a good one. Um, Probably the one I think that I would do the most now if I was still seeing patients regularly, which I do miss in this work, so this is fun to do, is sort of that what matters to you, um, and going in with as few assumptions about the person's health, knowledge, history as possible. I always say a story about how I had a patient who, when I was much younger, I went in and started just rattling off my thing, right? Whatever. It's embarrassing, whatever I probably said back then. But then I found out within a few minutes that she was a registered dietitian and a patient. And so I was so struck by that feeling of like, oh, how dumb. I didn't even ask her the questions to find out what she knew. Like I
Yeah.
could have saved all that like basic stuff that Zach, you said, that
Right.
of course I wasn't saying eat less, exercise more, even back then, but I was going in with some basic stuff and I could have gotten into the really more complex and fun stuff with her had I just asked the simple question like, you know, what's your understanding about how to eat, how to exercise, how to move, how to do this? And what are you looking for from me? And
Yeah.
what matters to you in sort of value assessment? And then together we figure out, well, what have you tried before? What's worked well? What's
Mhm.
off the table? What are we not going to go down? I mean, I think that would be my philosophy or motto now. And being able to sort of, as the practitioner, be okay with if their answer is something weird or different or not what the
Yeah.
medical guidelines tell you you're supposed to do. Your job is to help the patient meet their goal, not yours.
Right. Yeah. Most definitely. That's very refreshing. This was great. This was a lovely conversation, as Kim would always say. This was very lovely. All of Nina's information is going to be in the show notes, so you can contact her there. But what are your socials now? Since Zach got you into TikTok and
Well, I
IG.
made mine starting with Dr. Nina Crowley on TikTok so that we're
Okay.
leading with that. I'm just by my name, Nina Crowley, on LinkedIn, and then on Instagram it's Nina M Crowley. So not very branded together, but that's my personal ones. SECA North America is the SECA pages, and I'll share those with you. And we will for sure hang out in Orlando in person if you're there for the OAC meeting in July, but maybe before then.
Yes, get more in another Sika. I am due. It was last month, right? So I'm gonna start. I think I've created myself a new goal. I think I want to watch that muscle mass grow, if it will grow, right?
Yeah.
Or
And if you want to go through your stuff together individually, personally, just let me know. I'm happy to talk through that with you and nerd out as much as possible into the
nerding
details
is
of
fun.
that.
All right. Well, thank you everybody for joining. This was a great conversation. Follow us at the Plus Sides wherever you get all of your socials, and we appreciate you all.
Thank you so much
So
for having me.
thank you, thank you, thank you. Hasta la pasta.
Today's episode is brought to you by Ro, a telehealth platform that's changing the game of GLP-1 access. What sets Ro apart? Ro understands the challenges of navigating insurance hurdles and the skyrocketing prices of GLP-1 medications. That's why they specialize in getting insurance approvals for GLP-1s. And if insurance is a barrier, they go a step further by prescribing brand name zepbound vials for prices close to those of compound GLP-1s. With Ro, you're not just getting a prescription, you're getting a partner in your journey that's helping you access affordable treatment and guiding you every step of the way. Whether it's insurance approvals or cost-effective alternatives, Ro is here to make sure that you get the medication you need. Visit ro.co/plussides with a Z today to see how they can help you take control of your weight management journey with affordable, accessible care. That's ro.co/plussides with a Z, making healthcare work for you. Check out the link in our show notes for more details. Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m., and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was, because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again, and the hot flashes are gone, which is, geez, really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through this same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our link tree, you can click on that and save money. If you go there and you meet all the criteria, and this might be something for you to try. So I just want to make sure you had this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our link tree and get what you need.
Are you interested in understanding GLP-1 medications like Ozempic, wegovy, or Mounjaro? Then join us on the PlusSideZ Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The PlusSideZ Podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the PlusSideZ Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The PlusSideZ Podcast. You're not alone. It's not your fault.